Bearcats, welcome into the online programming stream. I'm sitting with Dr. Wilmes here, and he's going to answer a couple questions about COVID-19 so you guys can be better informed, and so we can be better informed as a university. So thanks for joining us, Dr. Wilmes.
Thank you, Jacob.
What is COVID-19?
Yeah, that's, the COVID-19, what we're calling COVID-19, is actually the disease and the symptoms that are caused by the novel coronavirus that we first became aware of. Nobody in the world knew about this particular virus before December of 2019. Unbelievable as it is, that's just been a few months ago. I can't stress enough that it's called novel for a reason. We still are learning about what this, as you said, the COVID-19 is. So my answer today may change tomorrow or later today as we find out new information. But the classic symptoms that we're looking for are fever, sometimes with body aches, but a dry cough and difficulty breathing. As time has gone on over the last several months, there have been some cases where there's a lot of GI symptoms, abdominal pain, diarrhea, but still the main cluster of symptoms we'd be looking for would be those respiratory symptoms.
Sure. It's been widely stated that the population that are at high risk are elderly and immune compromised. How do college students play a role into this since they are traditionally outside of those categories?
I think that's a great question, and colleges and universities are asking that question. It's been asked in our crisis management team. I would respond twofold. Number one, students and much of our society is mobile, so it may not be that they are a high-risk category, but by potentially bringing the virus into the community, they can endanger those vulnerable populations. I think the second part of my answer would be that there are college students who may be young, but it's not just immune compromised, it's people with certain chronic conditions, diabetes and asthma, other lung conditions, etc. And many of our students do have that, so it's more of a direct implication for them.
So there have been no confirmed cases in the Maryville area or in Nottoway County. So what is the likelihood that a member of the Northwest community could contract COVID-19?
Another great question. I think it's hard to quantify, obviously, impossible to quantify, but I think it's fairly likely for the reasons I mentioned before. I think it's great that the country and the world is finally saying this is serious. We need to do social distancing. We need to do mitigation. We need to try to, control exposures. Whether you're a young college student or you're somebody in the community or you're elderly or you have health problems or not, the advice is the same, really, to protect yourself, is to avoid exposure as much as possible to people who have known or suspected to have that. If you have had those exposures, you need to self-quarantine, remove yourself from the general population. To state the obvious, you need to stay home when you're sick. I know that's something Americans don't do well, but that's a really important part of this. And then when we're out in public, as I mentioned, social distancing, but also frequent hand washing, use of hand sanitizer, cough etiquette, coughing into the inner part of your elbow versus, into your hands, those type of things.
So a lot of people may be asking, mom, dad, brother, and sister are staying at home with me. I'm in isolation. How long should I be in isolation, and is it affecting everybody around me that's in the house too?
Another great question, and again, we're learning a lot every day about this virus, but it's largely a respiratory precautions. Comes to mind, obviously, bathrooms and food service. So that's try to be determined, but it would be largely as best as possible isolated within that. The answer to the question about how long is kind of up in the air as well.
Okay.
But generally, obviously, if you're still having symptoms, you need to be isolated. Sure. And from there, I would recommend, phone communication with the healthcare provider on that. There have been various things, a week, 14 days. The quarantine thing, where you don't have it yet or you don't think you have it, but you might have been exposed, is 14 days. So I think that's a good rule of thumb after you become symptom-free.
So say a student is having symptoms similar to COVID-19, but they're nervous to go to the doctor's office because they don't want to get tested or have to go into quarantine. When should they be concerned enough to go ahead and go to the doctor or give the doctor a call?
I would say the answer to the last question is immediately, because, yeah, you want to know. They're not going to have you go in, so call and get information. I believe the best antidote to fear is good factual information, and so individuals should call the healthcare provider and get guidance. I think the first question is really important, but in some ways it's more disturbing. You might have seen the case in Kentucky where we had a confirmed case and they weren't going to go willingly into isolation. So first of all, you're probably not going to be popular. So if you think you have it and the issue is, I really don't want to isolate, very bluntly, tough. These are strange times and challenging times, and there is I think a social, moral and ethical obligation to do our part.
Well, can you tell us kind of what are the ways that we can keep from getting sick and not spreading more germs? I know you talked about hand washing and social distancing, and I think that might be the answer again, but if you can kind of elaborate on some of that.
I won't reiterate those specifically. What I might expand on, I think staying healthy is two parts. As you talked about, the various measures to try to reduce exposure to this virus or any other virus. The other part, again, are not rocket science, but they're incredibly important. We're learning more literally almost every day for all illnesses, the importance of adequate sleep, because that impacts our immune system. Irresponsible, and it probably is a strong word, but irresponsible behavior by even 1% of the population can seriously undermine the efforts of all of us, and I know it's everyone's desire to really get a handle on this. It's going to be challenging at best, but again, not to pick on the person from Kentucky, I want to say, are you serious? And that's what it's going to take. It's not just about me, but it really counterintuitively, it really is to every individual's best efforts to come together as a community, and obviously it's also good for the community.
With your professional expertise, what's the timeline do you expect that we're going to be going through this? I know that you're probably getting that question a lot right now.
I do, and that's why I kind of smiled. It is a tremendous question that nobody on the planet has an answer to.
Perfect.
And I will say one other thing, and I don't mean this as doom and gloom.
Yeah.
Most of the experts predict that in the United States, they're projecting late May and June when we would be at a peak. And
sure.
As we talk, we haven't talked about that, I guess, but you've probably seen it in other venues. The goal when we're in a situation like this, it's probably an overused phrase, but is to flatten the curve, so that we're just not overloading the healthcare system, overloading our society with so many cases at once, but by try to, all these things we've been talking about, keep it to a hopefully manageable level.
Perfect. Well, Dr. Wilmes, we want to thank you for sitting down with us and taking a little bit of time out of your day to chat with Northwest students and residents, and hopefully we can chat very soon and do a debriefing of how everything has gone once this is clear and gone. But Bearcats, we want to take a moment and thank you for tuning in with us, and keep up with our hashtag. That's going to be hashtag NWBWell. That's where all of our programming is going to go these next couple of weeks. So make sure that you're checking that out. Not just wellness, but residential life, the Student Rec Center, the OSI, all those folks. We're all going to be working together to help bring programming into your homes and keep you guys connected to campus, because we do miss you. We're ready for you to be back, but we want you to be home and quarantined for now, so you can come back in the fall, because we are anticipating everybody to be back in the fall, and we're excited for a new school year. Thanks, Bearcats. Take care.